Sports-related traumatic brain injuries, or TBI, is an important public health concern estimated to affect 300,000 to 3.8 million people annually in the United States. Although injuries to professional athletes dominate the media, this group represents only a small portion of the overall population. From 2003 to 2012, in total, 4,788 adult sports-related TBIs were documented in the National Trauma Data Bank, which represents 18,310 incidences nationally. Chronic traumatic brain injury encompasses a spectrum of disorders that are associated with the long-term consequences of brain injury, including chronic traumatic encephalopathy, post-traumatic Parkinsonism, and post-traumatic dementia, and CPCS. A concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. Concussion signs observed are they cannot recall events prior to or after a hit or a fall. They appear dazed or stunned, forgets the instructions, is confused about an assignment or their position, or is unsure of the game score or opponent. They move clumsily, answer questions slowly, lose consciousness even for a brief moment, and shows mood, behavior, and personality changes. The symptoms reported are headache or pressure in the head, nausea or vomiting, balance problems, dizziness, or double or blurred vision, bothered by light or noise, feeling sluggish, hazy, foggy or groggy, confusion or memory problems. They report just not feeling right or feeling down. They're sometimes these are something that should really be taken seriously. Dangerous signs and symptoms of concussion are one pupil larger than the other, drowsiness or inability to wake up, a headache that gets worse and does not go away, sluggish speech, weakness, numbness, or decreased coordination, repeated nausea and vomiting, convulsions or seizures, which include shaking or twitching. Unusual behaviors increase confusion, restlessness, agitation, loss of consciousness. Even a brief loss of consciousness is really a serious matter. Post-concussion symptoms or syndrome. Post-concussion syndrome. While most children and teens with a concussion feel better within a couple of weeks, some will have symptoms for months or longer. If your child or teen has a concussion symptom that lasts weeks or months after the injury, their medical provider may talk to you about post-concussion syndrome. While rare, after only one concussion, post-concussion syndrome is believed to occur most commonly in patients with a history of multiple concussions.